team who would like to watch or who's unable to attend, they'll be able to. All right. Well, good morning, everybody. Thanks again for joining us today. We are excited to host this informational training around some information around the COVID-19 vaccine. And today we have with us Dr. Rasha Karan. She is an infectious disease doctor with Kern Medical. Dr. Karan is here to provide us with some great information around the COVID-19 vaccine. And as I had mentioned, we will have some time for a Q&A portion in this training. So if you have some questions, this is the time to ask the expert. Additionally, we want to send a special thanks to our Central Valley RP, Mr. Sami Abiyawi, for connecting us with Dr. Karan and really making this training possible. We really appreciate that. So with that, I'll go ahead and turn it over to Dr. Karan. Thank you.
Good morning, Mission Bank employees. I really want to thank you for inviting me today and to talk about this topic. I think it's very important and essential that we send out correct information as much as possible at this time. I'm going to share my screen. Let me know if you see it.
Looks good. I can see it from my side.
You see it, okay.
Thank you.
So today I'm going to talk about COVID vaccination and why and is it safe, and try to address some of the questions that people might have. Obviously, it is very important that people make an informed decision about anything they put in their body or anything they do to themselves. And they have to know exactly what it is and why, and if it's safe or not, before they make any medical decision, and that's very wise. So let me see if I can advance. Yeah. So it is your right to know, obviously, and those are some of the questions that I received through via email from some of the employees, and I'm going to address them in this talk as well. So you probably already know, I'm not going to go into details of what is going on, but to summarize it, there has been 222 million cases worldwide, and unfortunately 4.5 million deaths attributed to COVID-19 infection as of this morning. This is a this morning screenshot of the update. And so, okay, well, is it a bad infection? Why do we care much about it? Isn't that just like the flu? If you look at out of 100 people, this is on average, between young, old, everybody, out of 100 people who get COVID-19 infection and get diagnosed with it, 2.3 die. So this is way more deadly than the flu, or as used to be, thought initially. So it's pretty deadly. But what really bothers me, and what really is, I think, is more important to me than really the deaths, is the people who get it and don't die. And those are the people we see in the hospital, and they really hurt. It hurts us to see them, and this is why we become so passionate about spreading this information. It's people who make it, and so out of 10 people, 2 people, so that's 20% of people who get it will have severe disease. And severe disease means you get admitted to the hospital, you require oxygen, you might go to the ICU, you might get intubated. And the deaths are a small part of the severe disease. So 2 out of 10, that means every one of us have had, it's almost guaranteed that every one of us knows someone who at least had severe disease, or unfortunately, hopefully not, but someone who passed away from it. So this is pretty significant. We're not talking about something not important. And 8 out of 10 get mild disease. So, and that's what I was just talking about. This is a picture that's kind of close to what we see every day in the hospital. And the problem is that due to privacy laws, we cannot take out a camera and just start videotaping and then spreading this on TikTok or Facebook and showing what happens to people in the hospital. This is against HIPAA laws. And so this is one of the problems, is that the public doesn't necessarily see what happens to those people who get admitted to the hospital? This was one story that was published. This is a coach from Colorado, was previously healthy. Obviously, he was a coach, very healthy man. And this is what I'm talking about. The 20% of people who just become changed forever, and they're not the same. This guy, probably tell, lost weight and is oxygen dependent now. And he's disabled, cannot do his job again. So this is, I think, a larger impact than the deaths. So both are large, but this is really, really painful. So how do we end the pandemic? Let me show the next slide first. A pandemic, so historically, and sorry for the gross picture, but we had smallpox in the past in 1978 or so at the end of the 70s. It was announced that smallpox was eradicated from the world. There's no more smallpox. We're not even vaccinated for it anymore. How do we get rid of smallpox? By vaccines. When it comes to infectious viruses, the only way to really eradicate them is by vaccines, and that's been the case. I think we have gotten so healthy that we don't see this anymore, and that's why it doesn't, it doesn't. The importance of vaccination doesn't show as much as it used to in the past. You can see mumps, polio, because we get vaccinated, we no longer see kids with disabilities like we used to in the past, and people don't die of whooping cough as much as they used to. So how do you end the pandemic? You end it with vaccines. And when it comes to viral illnesses, especially, it's usually vaccines, because especially when they're very infectious. You can't. The problem with COVID-19 is you're always one step behind the virus because people infect before they don't know that they're infected. So, it's very, very predictable. So you have exposure today, 5 days later, you get the first symptom. Day 4, which is the day before your first symptom, is when you're the most infectious. So it's always the case, people infect their parents or their loved ones before they knew that they were sick. And that's why we're always a step behind the virus. It's impossible to control it if we only wait until we get sick and then control and then isolate ourselves. That's why we have to be careful all the time, not just when we're sick, because the most infectivity is the day before we get sick, and it lasts for about a week after. So luckily, we got these vaccines, and there's 3 of them approved in the United States. 2 are RNA-based, and 1 is vector virus. So the Pfizer, Moderna, and Johnson & Johnson, and you can see the details of how many shots and or where it's approved. The way to end it, there's another way to end the pandemic, is to let everybody get the infection and let whoever's going to die, whoever's going to get disabled. We're going to end up with 20% of the population who got it disabled, and about 1 to 2.3% die, which is really, that would be devastating. So the vaccines have common side effects, and those we actually don't call them side effects necessarily. Those are what we call immunogenicity signs. After people get the vaccine, they will have fever. Most of them will have fever, body aches and soreness, and that can last for 1 to 2 or several days. Joint pains, headache, tiredness, especially the second dose. I had to stay in bed. It was, it was more severe than the first one. But this is what we call immunogenicity, meaning this is the result of your immune system being activated against the virus. And actually, people who don't get fever and these symptoms the day after the vaccine, we think maybe they didn't pick up the immunity. So if you get those symptoms, it's a good sign that your immune system got angry enough that it's going to fight next time if it sees this virus. This is essentially you're getting your armies ready to fight. And so those are not considered a bad outcome or side effects. However, there are severe side effects that we worry about, and those are the ones that are listed in this table. And those include myocarditis, anaphylaxis, immune thrombocytopenia. So in the United States, like I said, we have 3 vaccines emergency authorized for use. One of them is FDA approved. The myocarditis, the first item, is inflammation of the heart muscle. And that's something that we used to see before vaccines. I mean, we see it once in a while. Someone comes in fever, shortness of breath, unknown. We used to not know why it happens. We think they are viral infections. So people get a virus infected with a virus and then affects the heart. Sometimes we could identify the virus, sometimes we could not. And so these viruses that we get every season can go to the heart in certain people and cause inflammation. And then the virus gets out, people usually recover. And it's rare, sometimes rarely, that people get severely ill with it. And so there's been more myocarditis numbers after the vaccines, and they think that they might be attributed to the RNA vaccines. And if you look at the numbers, it's around 4 in the million, and that's how common they are. And it varies according to different groups, but this is on average. Most of those were treated and recovered. And so 4 in a million. Anaphylaxis is another thing that we worry about. The incidence is about 11 in a million. Again, this is why we watch people for 15 minutes. Most of those happen within the first 15 minutes of injection, and they are treatable. This is why you have to get the vaccine in a place where, especially if you have history of allergies, you want to take it in a place where you can be treated for allergy. And most of them are, again, treatable. 11 in a million. Immune thrombocytopenia happens with the Chadox, the one that's made in Britain. And it can happen with the Johnson & Johnson one, not with the Moderna and Pfizer. 3 in a million. Guillain-Barré is another condition we used to see randomly happen in people. We think it happens as a result of viral infections. The body immune system attacks the nerves and becomes weak, and they can recover or not after. And that's been seen after, again, the not the Moderna or Pfizer, against the vector vaccines, such as the Johnson & Johnson and the Chadox vaccine. But if we look at the chances of you getting struck by lightning or dying from being struck by lightning, it's 1 in 138,000, which is actually more than getting those reactions. So they're very rare, which is why we think they are safe. It's really rare to find even a Tylenol, pill of Tylenol can have side effects. And so this is considered really rare, luckily. However, if we get COVID, the chances of dying from COVID would be 23,000 in a million, as opposed to getting these reactions. We're talking about 1 or 11 in a million. So if you look at the risk and benefit, you always want to weigh, what is my risk if I get it? What is my risk if I don't get it? And absolutely is way more risk if you don't get it in this case. So some of the questions that we received: if I'm strong and healthy, do I need to get the COVID vaccine? And this goes back to who is at risk of severe infection. And you can see the list of medical conditions on the right. However, one of them is the obesity part, which I didn't like actually at all, because BMI is a calculation that has to do with your height and weight. And this is true. We see that people with higher BMI get more severe disease, and BMI more than 30, but also overweight BMI 25 to 29. My BMI is 27. So I actually fall into a risk category, and we don't think of this as being medically ill, but with COVID-19, weight has a lot to do with it. The metabolic syndrome, weight, diabetes, and it's not discovered why, but that's a pretty, we see a lot of patients who are healthy in their 40s or 30s, but they're a little chubby, or just BMI 27 is not really considered overweight in the public. But we have seen people who also didn't have any of those risk factors and still got really sick. Some of it we think is genetic. Pregnancy is another risk factor. So that's why it is a good idea to get the vaccine again, because of that, especially if we think that the risks are low. Which, we explain some, and we'll explain more down the top. If I already have COVID-19, do I still need to get the vaccine? And the answer depends on how long the immunity after COVID-19 infection lasts. And do people get it again? Can they die if people get severe disease if they get it again? And the answer is, yeah, there are people who got it again. It's not common. Got it again and died. They didn't die the first time. That's not common, but you can get it again. And then when they measured the immunity after, the vaccine was longer or more durable immunity than after infection. The highest immunity was actually people who got the infection and then received a dose of the vaccine. Those have the most robust immune response to it. The other issue is if you measure your antibody level in the blood after getting infected, it has nothing to do, it does not predict or correlate with protection, because those antibodies are not necessarily what we call neutralizing antibodies. They're not the type. There are many antibodies that we make against the virus. That doesn't mean that these antibodies are the ones that stop it from replicating. So the tests that are out there commercially available, they don't measure the neutralizing antibodies that predict your protection against the virus. Those are only available in like research facilities and stuff. It seems like there was a rush to create the COVID-19 vaccine. How do I know it's safe? So regarding the rapidity of developing it, those clinical trials, when they did them, they actually, if you see the picture on the right lower one, they overlapped some of the phases. They didn't actually cut corners. They didn't remove or omit any of the steps. They just started them at the same time, several ones right after. They used to wait between each step and the other. This time they started most of the steps shortly after the first one. So they didn't wait a year and then a year and then a year. And that's one thing. But there was no cutting any steps that were necessary. The other thing is the research with mRNA vaccines has been going on for 10 years, including in humans. And so it's not like it just started. They've been working on it, and this happened to be an opportunity that came out, a new infection, so they just used it. But they've been working on it for 10 years and testing it for 10 years before the pandemic happened. The risks of my kids getting vaccinated. I am vaccinated, but I'm scared to vaccinate my children. On the right is a picture of my son when he got vaccinated. Obviously, I would not give my son anything. I have any doubt that it's going to hurt him. Hurt him versus like the risk and benefit is not for it. And so the risks of the kids getting severe disease are small. However, there are risks from the infection. If you see COVID-19 infection, there's something called MISC. What that is they don't get pneumonia and shortness of breath as much as they get inflammation of the heart and inflammation of the brain and these immunologic problems that are called multi-inflammatory syndrome children. And so that does happen, and there's 3% of kids that are diagnosed and tested with infection get hospitalized. There's a very low death rate, but there's morbidity there. Besides this, the fact that the risks are very small, and the fact that they do also give it to adults and parents. And so in order to stop the spread of it, you really want people to stop getting it in order to stop the spread of it. And, and then to stop forming into strains. Also, it will only mutate if it's replicating in people's body. The virus does not replicate outside the body. It cannot do that. It uses our cells to replicate. So without replicating, it cannot morph into new strains. And we have to stop it in everybody in order to eliminate it from the community. How long will the vaccination protect? Do I need a booster? If you're immunocompromised, yes, you need a booster. Actually, now it's been shown 28 days or 4 weeks after the second shot, you are advised to get a booster. Now, for people who are not immunocompromised like us, we will be getting the booster 8 months after the second dose, and that's based on the fact that they're starting to see new infections now in people who are vaccinated early on. About 8 months after, they started getting more infections. However, all those who are getting infections now, or not all of them, but most of them are still getting really mild disease. So the vaccine is still protecting against severe disease and death, even in people who have been 8 months out. But they're just getting more infections, mild infections, and that will lead to it spreading again more. And that's why there are a small minority that are getting severe disease, but mostly mild infection. They just started, so the prediction is that the immunity will go down after 8 months, and that's why it is recommended to take a third shot in 8 months, especially healthcare workers. But if you're immunocompromised, yes, your immunity will go down weaker. If you look at the studies that were done for who picks up the immunity from the vaccine better than others, immunocompromised people were less likely to become immunized after they get the vaccine. There's a percentage that did not, and when they gave them the third shot, half of the ones who didn't pick it up in the second shot got it in the third shot. But on part of those people were the obese people, overweight people. But nobody talks about that because people think of immunocompromised as just AIDS and chemotherapy and steroids and blah, blah, blah. But nobody is talking about really the obesity, which is overweight. Those are also risk factors for not getting the immunity. And if you see a lot of people who got vaccinated and they got infected, yeah, you can get infected with mild disease, but if they're obese, there's a chance they did not pick up the immunity to begin with. So if I am vaccinated, why does the CDC recommend wearing a face mask? Because the vaccine protects you from death and severe disease, but you could still, although a lot less likelihood, but you could still get infected, usually with mild disease, and a lot less possibility, and you can pass it on to others. And this again goes back to, I have the habit of every time I go into a COVID room, I ask patients about that, like the ones who are suffering and really in bad shape, they're gasping for air. What was the reason they didn't get vaccinated? And most of them are parents or moms whose kids told them not to get vaccinated, or social media told them not to get vaccinated. And then the kids, because the kids are not worried, they go out, they party, and then they get infected. They're very mild, nothing happens to them. They bring it to their mom. And mom dies, or mom gets very severely ill with it. Mom gets admitted to the hospital. And this breaks your heart every single time. It's an altruism kind of a situation. You wear it to protect others, your parents, your coworkers, anybody around you who might not have the same immunity or immune system like yours. That's why we continue to wear it. But we're protected, so you're fine. It's to protect others. So what's up with mRNA? Most of the concerns that started right after the vaccines were made were because this is an mRNA containing vaccine. And that led to people concerns. Well, mRNA is genetic material, so how you're gonna give me genetic material? That would be concerning. Like if I hear someone's gonna give me genetic material, I would have to understand what it is exactly. If you know, our cells have DNA as the genetic material. So what's RNA? RNA is the messenger that takes the messages from the DNA and translates it into proteins. So in order for your DNA to say, okay, let's make this collagen and that melanin and these proteins, it sends these messages through the RNA. So the RNA is a messenger, and it sends messages to make proteins. And there are viruses that their genetic material is just a messenger. They don't have DNA, they just have RNA. One of them is COVID-19, one of them is influenza, one of them is polio. A lot of viruses have RNA as genetic material for them. They're not as intelligent as our cells. So what would happen if RNA gets into your system? If you look at the picture, see the coiled structure in the middle, the blue coil, that's the RNA of the virus. Okay? If you open it up and straighten it out, it will look like the line at the bottom, the long line that starts from 0 to 29 line. And then look at the green square that says S. That's the segment of the RNA that translates to make that protein, that's spike protein on the top. It says spike protein S. So this segment of the RNA sends a message to your machinery to make that protein. So when you get infected with COVID, you're going to get the whole RNA in your body, multiplying millions and millions and millions of COVID entire genome RNA multiplying in your cells. The vaccine will only put that S segment in your body, not the whole thing. And that's why you're not going to get as sick. So the idea of having RNA in our system, I mean, getting infected, it puts tons of RNA in your system, and it's COVID RNA. It does not get into your DNA, it does not incorporate into your genome. As a matter of fact, people who do research with RNA, they know that RNA disintegrates really quickly. Like when you do research with it, you really try to do things to try to stop it from disintegrating and disappearing. So it disappears quickly after it's injected, it just makes the proteins and then disappears. So, but I understand, and you understand why people would be concerned, because it's a genetic material, and RNA, DNA, this is a new topic. However, it's a fraction of what the virus puts in your body if you get infected. So why do we have what we call misinformation, social media misinformation? Unfortunately, with the pandemic, there's a lot of people who came out and they're like experts and talking about it and saying don't do this or do that. And a lot of it we know is wrong. For example, when the pandemic started, they said, well, the hospitals are empty. There were videos of people walking in the parking lot saying, look at the parking lot, it's empty, the hallways are empty, there's nobody in the hospital, these doctors are lying. We're in the ICU, we can't find ventilators, people dying. But because we're not allowing visitors, the parking lot is empty. Yes, but that doesn't mean there are no patients. And so we knew it was wrong, but we just don't have the time. I don't know, as physicians, we don't have the time, and we don't effectively communicate that with the public to show them what is going on for real. So whoever does have the time on social media, they will just spread their information. So one part was politics, and that's something that mixed politics with medicine is not a good idea, but all you want to know is see if the politicians who affected your decision have been vaccinated or not, and most of them have. And so that they have the good information, and they have all the information, the advisors. And so if they got vaccinated, why would they tell you not to get vaccinated? The other thing, we were busy, like I said, and tired, and we don't like publicity. I mean, before the pandemic, nobody knew what an infectious disease doctor does. And that's why people who didn't like publicity, and like myself, went into infectious disease, and we never thought we would have to start like being visible to the public now. So we're not as sexy as those people who come out on social media and start talking. We don't get as much attention. And then fear of uncertainty. This is a natural psychological mechanism. When we're afraid of something, we're more likely to believe that it's not true, or there's a conspiracy theory. That's just human nature. This picture is a snapshot of physicians having a webinar or seminar about COVID. You can see we are not good looking or sexy or attractive by any means. Look at the guy on the right lower screen. These are the physicians talking about COVID-19. Very boring. This is another one. My camera on the left upper wasn't even working. So versus people like this who would come out on social media, and she will definitely get more attention than we will. So that's just nature of the beast. So again, conclusion, they are definitely a lot safer than getting COVID, and they are safe for the most part. I didn't hesitate to get mine, and I made sure my parents and my family members got it, and we're fine. And so far, we did well, and nobody got infected from anybody who got the vaccine. They are effective, really effective compared to what we predicted or wanted before, and they will reduce your risk of severe illness or dying. And so with that, I know I went way over the limit, but if anybody has any questions, I'd be happy to answer. And hopefully we can get rid of this pandemic and end it as soon as possible.
Excellent. Thank you so much. Great information. I hope everybody on the line found it informative and informational. Now is the time. If you've got a question, feel free to jump off of mute and you can shout it out. You can also send it in the chat feature. In addition, if you'd rather not share here on this platform, you can use the link that was provided in the Outlook invite, and you can submit your questions there. Those are all submitted anonymously. So you've got plenty of options.
And there is no bad question, by the way. People, if you don't question something, it's, it's not good. It's, I really welcome questions. That's just the way you're going to understand, or debate or argue. There's nothing wrong with it. It's not like it's not going to be an issue with you disagree or you have concerns or you want to talk about it. I have this is just for you. I mean, it's whatever helps you.
Absolutely. Looks like we have a couple of questions in the chat box.
So what's the recommended timeline to receive the booster? If you are immunocompromised 4 weeks after the second shot, and there's a definition for immunocompromised, if you're on chemotherapy, HIV, AIDS or HIV, on steroids, a lot of people are on steroids, immunocompromising medications or conditions 4 weeks after the second shot. If you are not, then 8 months after, and that hasn't been yet out there. We haven't been able to get the booster yet. So that's going to be mid-September, which is 8 months after the second shot. Do you believe taking the shot is good for pregnant nurses? Oh, very good question, and I did not address it. So at the beginning, it's unethical when we do research. We cannot start with pregnant women or children. Anybody who's less, weaker or less privileged or institutionalized, we don't do research on. So the initial research was done on just the public. And however, there were many women who got pregnant right before or after the vaccines and who found out that they were pregnant after. And so there were thousands, and those were studied and followed, and they found that there was absolutely no problem. Nothing happened to them, even the ones that got it in the first 3 months, which 12 weeks of gestation, which is really the time we worry about the developing fetus. They were fine, whether they got it right before or way before. There were no effect on fertility, meaning the ones who wanted to get pregnant, and there were no birth defects. And actually, so no increased abortions or premature delivery. But getting COVID is high mortality and high risk, just any fever, COVID in pregnancy and high mortality and high likelihood of premature labor or abortion. So that led to the recommendation of the OBGYN doctors seeing all those patients, how risky it is for pregnant women. They started advising their patients or pregnant women to get it. And now it is thought to be safe and effective for pregnant women, and it's advised to give it to them. However, the one thing that you have to be careful if you're pregnant is just having a fever, even if it's from the flu. We don't like it can cause premature labor. So if you get a fever, you want to take Tylenol. We don't necessarily advise everybody to take Tylenol after the vaccine, but pregnant women, yes, take Tylenol. It's just better. But there has been no signal for bad outcomes so far in pregnancy or in fertility effect after. And those who deliver, they had protective antibodies in their milk, actually, that they gave to infants, which and there was no harm to the babies who are being breastfed. How long do you have to wait before you can get the vaccine after after you've recovered from COVID? You can get it 4 weeks later. Well, you have to be recovered, recovered and not having any fever and so much better. But you can get it 4 weeks, but up to 3 months you're protected. So at the beginning of the year, we used to say if you had an infection, wait 3 months because you want to we didn't have enough vaccine, so give the vaccine to people who need it more because you're protected. So save it for others. But now, if it's available, then you can get it as short as 1 month. But if you get it up to 3 months after, there's no problem. But do you have any advice on limiting the side effects of receiving the second? I wish. So, I mean, the thing is, okay, this is when I get those symptoms, all I think is, well, this is number one, this means my immune system is really being stimulated. I'm happy. It doesn't feel good. It kicked my behind, but I'm happy that my immune system is responding. So it's a good sign. I would not take, you can take Tylenol or ibuprofen if the symptoms are bad. And actually I did, but if you don't take them, it's bad. We don't advise that you have to take it. If you have to take it, take it. take Tylenol, take ibuprofen if needed. I took it because it was I had to, but if you didn't have to, don't take it. And if you didn't get the fever and body pain, that's when I would worry that maybe your immune system wasn't really stimulated. And again, that's just, it just tells you that your body is being activated. This is another thing, a way I look at it is, this is just the spike protein part entering my body. Can you imagine what I would feel like if I had COVID, the whole thing? So it could be, maybe a lot of us think that the more severe symptoms you get after the vaccine, it could be representing, you might have had severe symptoms after getting COVID too. But that's not easy to study, you can't study that. What are the side effects reported from after the booster shots? Again, booster shots are not yet, for immunocompetent patients, they're not yet started. But for in studies and immunocompromised, like in Israel, they did start doing that. And in older people, it just really boosted their immunity after they lost it. It's just similar to the second dose. And I had friends who are immunocompromised who took the third one, and they said it was very similar to the second dose, which is body pain, fever, just flu-like symptoms. And that's really, we don't even call it side effects. It's immunogenicity, meaning it's just the result of stimulating this immune system and getting it ready to completely fight COVID itself, if you get it. Did I miss something? How long? Good for pregnant. Are the current vaccines effective against all variants? Currently, good question. Or is it expected that we will have to have new vaccines? At this time, the Delta variant is more transmissible. It's actually, way more transmissible, possibly more severe also. The vaccines protect very well from having severe disease or dying from the Delta variant. So to me, that's what matters. However, you can still pass it on, which is the problem. And to someone who was not immune, and then they're going to get sick, loved ones, older people, immunocompromised, blah, blah, blah. So that's the issue now. But it still does protect from severe disease and death very well. I mean, good numbers, high numbers. Now, are we expected to have new vaccines as it evolves? Again, for the Delta variant, although there's a bit of a change, it still protects people. So we might in the future, but at this time, it does protect people and lowers the likelihood of them passing it on as well. I know we hear the headlines always catch the scarier part of the news, or they want attention, they want. But it protects you from the Delta variant very well, and that's the truth. And the truth is boring, unfortunately, always boring, and it does not catch people's attention that easily. But scary things are more and more. They get more hits and more shared and stuff like that. What other concerns? I think kind of covers most of it, but if you have any question or any comment or concern, or something you want to address, please go ahead and share it. And if you think of something after, I'll be more than happy to address them in a way that we can talk about. If you don't want your name to be there, again, this is for you. It's not about, if you want to send something afterwards anonymously, please, and we can have Diane email them to me, and we can email them back, anytime.
Yeah, absolutely.
Mm-hmm. What about the new variant? It's just another variant. Again, and the Delta is more prevalent than the new right now, but it's just another variant. And again, so far the vaccines protect you against all the variants. With the like, there's nuances and small differences, but they're not important differences overall. You're welcome, Elizabeth. Sorry, Diana, interrupted you.
No worries. These are all excellent questions. Thank you, everybody, for contributing
Yeah.
and being curious and asking these really good questions. As stated before, if you think of something maybe after our call, feel free to shoot Human Capital an email or respond to that survey in the Outlook invite. And we'll definitely get the questions over to Dr. Karan to field and get some answers to you. Yeah, with that, I think we'll go ahead and wrap up. Dr. Karan, thank you so much. Thank you so much for providing all this information with us this morning. We hope that everyone on the call found it really informative. I know I definitely did. I think, like many of us, we've kind of been inundated with information over the past year and a half of what this all means, but I'm still learning things new. There's still so much more information out there, and this has been extremely helpful and insightful. So thank you so much for taking the time this morning to share with us. We greatly appreciate it.
Diane, it's my pleasure and actually my duty also. So thank you for the opportunity.
Thank you. All right, everybody, we will let you jump off and get started with your morning. Feel free to reach out to us if you have any questions or concerns. Thank you so much, everybody. Have a great day.
Thank you.